Intense pulsed light, or IPL, and laser treatments have revolutionized the field of aesthetic medicine. They offer safe and effective solutions for various skin concerns. These treatments use light energy to target specific chromophores in the skin, such as melanin for pigmentation issues and hemoglobin for vascular lesions. IPL emits a broad spectrum of light wavelengths, whereas lasers emit a single, focused wavelength. This difference allows for precise targeting of specific skin concerns. Both treatments also stimulate collagen production, resulting in firmer, smoother skin. IPL and laser treatments can address a multitude of skin imperfections, including age spots, sun damage, rosacea, and unwanted hair. They can also improve skin texture, reduce pore size, and minimize the appearance of fine lines and wrinkles. Understanding the principles and applications of these treatments is crucial for practitioners seeking to provide optimal care.
Various IPL and laser devices cater to specific skin types and concerns. IPL devices, known for their versatility, can treat a range of conditions including pigmentation irregularities, vascular lesions, and unwanted hair. Different filters can be used to target specific chromophores in the skin. Laser devices offer more targeted treatments. Examples include ablative lasers used for skin resurfacing and non-ablative lasers designed for skin rejuvenation. Ablative lasers remove the outer layers of the skin, while non-ablative lasers target the deeper layers to stimulate collagen production. When choosing a device, practitioners must consider factors like skin type, treatment area, and desired outcome. Safety is paramount. Practitioners must be adequately trained and adhere to strict safety protocols, including using appropriate eye protection for both the practitioner and the patient. Selecting the appropriate IPL or laser treatment hinges on careful assessment of the individual's skin type. The Fitzpatrick scale, a numerical classification system, categorizes skin types based on their response to sun exposure. Understanding this scale is crucial for determining treatment parameters. Lighter skin types, Fitzpatrick unto the third, are less prone to pigmentation issues and respond well to various IPL and laser treatments. Darker skin types, Fitzpatrick the fourth to six, require caution due to their higher melanin content. Excessive heat can lead to hyperpigmentation or hypopigmentation. Consultation with a qualified practitioner is paramount in determining the most suitable treatment plan. Practitioners should conduct a thorough skin analysis, considering factors like skin tone, texture, and sensitivity. Open communication with the patient about their expectations and potential risks is essential. A comprehensive client consultation is the cornerstone of successful IPL and laser treatments. It allows practitioners to understand the client's concerns, assess their skin condition, and determine the most appropriate treatment approach. During the consultation, practitioners should obtain a detailed medical history, inquiring about allergies, medications, and previous cosmetic procedures. This information helps identify potential contraindications or factors that may influence treatment outcomes. A visual examination of the client's skin should be conducted to assess its type, texture, and any existing conditions. Explaining the treatment process, potential risks, and benefits in a clear and concise manner is crucial. Clients should be informed about the number of sessions typically required, the expected downtime, and the possibility of side effects. Addressing the client's questions and concerns openly and honestly builds trust and ensures realistic expectations. Effective communication is paramount throughout the entire treatment journey. It fosters trust, ensures client satisfaction, and minimizes the risk of misunderstandings. Practitioners should communicate clearly and concisely, using language that the client can easily understand. Managing client expectations is crucial. While IPL and laser treatments can deliver remarkable results, they are not instant fixes. Clients should be informed that multiple sessions are usually required to achieve optimal outcomes. The importance of patience and adherence to the treatment plan should be emphasized. Providing realistic timelines for visible results is essential. Clients should also be made aware of potential side effects, such as redness, swelling, and temporary changes in pigmentation. These effects are typically mild and subside within a few days. Emphasizing the importance of aftercare in achieving optimal results is crucial. Adhering to stringent safety guidelines is paramount when performing IPL and laser treatments. Practitioners must prioritize both their own safety and the well-being of their clients. Proper training and certification are essential for understanding the intricacies of these treatments. Protective equipment plays a crucial role in minimizing risks. Both the practitioner and the client must wear appropriate eye protection to prevent potential eye damage from the intense light emitted during treatment. The treatment area should be properly prepared by cleansing and shaving if necessary. The use of cooling devices or gels during treatment helps protect the skin from excessive heat and minimize discomfort. Following the manufacturer's instructions for each device is crucial. Practitioners should regularly calibrate and maintain their equipment to ensure optimal performance and safety. Proper aftercare is essential for maximizing treatment outcomes and ensuring client satisfaction. Following IPL or laser treatments, the skin may be more sensitive than usual. Clients should avoid sun exposure and use a broad-spectrum sunscreen with an SPF of 30 or higher daily. Moisturizing the treated area regularly helps soothe the skin and promote healing. Gentle, fragrance-free products are recommended to avoid irritation. Clients should avoid harsh skincare products, exfoliants, and hot showers or baths for at least 24 hours after treatment. Picking or scratching the treated area should be strictly avoided, as it can increase the risk of infection and scarring. Clients should inform their practitioner of any unusual side effects or concerns. Regular follow-up appointments allow practitioners to monitor progress and make any necessary adjustments to the treatment plan. In the ever-evolving field of aesthetic medicine, continuous learning is essential for practitioners. Obtaining certification from reputable institutions demonstrates a commitment to professional development and ensures that practitioners are equipped with the latest knowledge and techniques. Certification programs provide comprehensive training on the principles of IPL and laser treatments, device operation, safety protocols, and client management. They also offer hands-on experience, allowing practitioners to refine their skills under the guidance of experienced instructors. Staying abreast of the latest advancements in technology, treatment protocols, and safety guidelines is crucial. Attending conferences, workshops, and webinars allows practitioners to expand their knowledge base and network with other professionals in the field. This commitment to continuous learning ensures that practitioners can provide their clients with the safest and most effective treatments available.